As it started. Hello, it's me Sandesh, and I'm here with Pinky and Kinjal. Together, we are going to do a presentation on sexual health resources and services. So it's going to be divided into three parts. And for the first part, I'll be doing it, and for the second part, Pinky is doing it, and for the third part, Kinjal will be doing it. And as for the first part, I'm going to start with the sexual health resources support and services lesson plan. And the sexual awareness lesson consists of sexual health education, resources, support, and services. And as for the group members, it I already told it's Pinky Singh Poon, Kinjal, and Sandesh. And the goal and learning outcome would be increasing awareness and understanding of sexual health resources and available support for sexual health. And the outcome would be defining what sexual health is, identifying local and accessible resources, identifying the available support and sexual health information, and how to reach available services, provide resources and support, provide knowledge regarding sexual relationship, birth control, STDs, consent, sexual boundaries, safety, and so on. And the duration of the lesson and learning activity will be 15 minutes. And the age group will be targeting will be young adults living with disabilities. And the resources and supplies for our presentation are from websites, visual ads like pamphlets, vouchers, simple diagrams, emotion board, etc. And sensory friendly environment, scenario cards. For the third slide, I'll be starting off with sexual health. So first of all, sexual health encompasses various aspects of an individual well-being, including physical, emotional, mental, and social dimensions related to their sexuality. The key components of sexual health involve maintaining a positive body image, fostering open communication about sexual desires and boundaries, and promoting mutual respect within relationships. The object of sexual health education include providing comprehensive information on reproductive anatomy, encouraging healthy attitude towards sexuality, and equipping individuals with the knowledge and skills to make informed decisions about the sexual well-being. And as for the fourth slide, and second topic will be reproduction. And the key components of reproduction involve understanding the male and female reproductive systems, the menstrual cycle, and the process of ovulation, con- conception and fertilization. Objectives in the realm of reproduction include educating individuals about the reproductive anatomy, promoting awareness of fertility and family planning, and encouraging preconception health practices. By achieving these objectives, individuals can make informed decisions about family planning and optimize their overall reproductive well-being. And for our third topic, that's going to be birth control. The key components of birth control include a diverse range of methods such as hormonal options, pills, patches, barrier methods, and long-acting reversible contraceptives. Objectives in the realm of birth control is provide information on effectiveness and uses of various methods, facilitating open communication about family planning between partners and guiding individuals to choose the most suitable contraceptive method based on their health and lifestyle. Ultimately, the goal is to empower individuals to take control of their reproductive choices. And for the fourth topic, that will be safety and protection. Safety and protection in the context of sexual health encompasses both physical and emotional well-being. Key components include understanding the importance of consent, open communication, and recognizing and respecting boundaries within relationship. The objective involves promoting healthy relationships built on mutual respect and trust, raising awareness about the sign of unhealthy relationship, and providing individuals with the tools to advocate for the safety and well-being. By achieving these objectives, individual can contribute to creating a safe and supportive environment for sexual expressions. And for the last topic would be sexually transmitted infections. Key component of STIs education include knowledge about common infections such as chlamydia, gonorrhea, HIV/AIDS, HPV, and herpes, understanding modes of transmission and recognizing systems. Objectives in the realm of STIs involve promoting preventive measures such as proper use of barrier methods, advocating for vaccination, example, HPV vaccine, and emphasizing on the importance of regular STI testings. Additionally, reducing stigma around STIs and fostering open dialogue contribute to creating a more informed and supportive sexual health community. And that's going to be all from my part. And I'll be handing it over to Pinky.
Okay, thank you, Sandesh. And now I'll be taking over the presentation, and my part is going to be about the learning activity. So, the learning activity we have created is called What Should You Do? So, it's a scenario card activity in which we are going to give some real scenarios or real life situations to other individuals, and we're gonna ask them like what should they do on that situations. So this activity will help us to provide a comfortable space for open discussions, and we can have our different opinions on different aspects of sexual health in various aspects of relationship, boundaries, and communication regarding sexual health. The objective of this activity is to promote awareness, build understanding, and encourage healthy conversations about sexual health. Through these scenarios, we aim to foster a supportive environment where everyone feels comfortable sharing thoughts and learning from each other. So, the activities guideline is respect and confidentiality. So, whatever opinions we get from the individuals, everyone should be respecting it, and it will be totally confidential. And we will have open communication so they can just go out with their own thoughts and opinions on each scenarios and ask questions, so they can ask any questions regarding the topic, like anything they want to know. And the key points, like this activity is based on the boundaries, consent, and communication on sexual health. So the materials that we'll be using in this activity will be scenario cards, whiteboard, and markers. So I have given some example of scenarios that will be presented in the card. So I'll just read one of it because it will take a lot of time. So one of the scenarios that we have created is Madison has been texting Marco saying that he's hot and that she wants to feel his abs. Marco isn't comfortable with what Madison is texting him. So what should we do in this scenario? So asking this to the individuals, we're gonna get their answers and how they are gonna respond to these scenarios. And yeah, we will be having a lot of opinions going around, and we will be forwarding it towards the right scenarios or right answers that we should be doing. So yeah, this will increase their awareness in like the consent and communication and boundaries that they have to make between two individuals, with their friends, with their colleagues, or even with their partners. And I got the references from this www.teachingsexualhealth.ca and www.niagararegion.ca. So yeah, that this was it for the activity part. And now Kinjal will be doing her part of the presentation. Thank you.
So my part was support and services. So how to support individual who's experiencing um sexual health education they want, or they are experiencing any kind of questions or something like that. So for that I have discovered sexual health clinic. sexual health clinic promotes healthy sexuality in terms of getting education. If you need any contracepting methods or you need any birth control, so they are for that. The sexual health clinic is located in Sudbury. Um, so various confidential services regarding sexual health services and treatment for STI prevention is being offered at that clinic. The clinic is run by registered nurses, public health nurses, and doctors. So how the clinic is work? So sexual health clinic is available everywhere in Ontario. You just need to research your neighborhood in that, and it's just not just limited to STI, sexual transmitted disease, but however, it also provides support for birth, birth control, healthy sex life, right decisions, consent, awareness of the body, and treatment and tests for any kind of disorders. So first of all, you need to book an appointment by on call. Then public health nurse will conduct a short interview or assessment. After the interview is done, then nurse will book an in-person appointment with you. So that's how you can book your appointment and get you cannot just go there in person, you have to make appointment for that. What are like other services have been provided? So calls to conduct tests and reports, pre-treatment option for sexually transmitted disease, knowledge for contraceptions, HIV testing, birth control option at low cost. um, for example, they also provide free contraceptive options and vaccines for hepatitis A and B. The location is provided in the PowerPoint, and the contact number is also there. Another app that I have researched for as a resource is it's like how to guide. So this is a navigation app for sexuality and relationship. It's specifically designed for teenager and emerging adults. So it's really easy to access and it's user friendly as well. So including people with disability can easily use this application. The providing support through online chat, SMS, and message board. It's on the immediate basis. So if you have like an immediate concern, you can just go there. Anyone can ask any question related to sexual education. And on this website, there are more than 50 question and answers are available for readers. So if you just wanna look into the website, you can look. There are like blogs, articles, books, and many other resources available for sexual education regarding sexuality and so on. The last app that I have searched, it's called HRSA, Healthy Relationship, Sexuality, and Autism. So this website is specifically created for people with autism. So and this app is only available for people age 19 or above. So it's not available for teenager. So the services are available through in-person session or online through Zoom meeting. This program, it's really beneficial because it's free of cost. So like you are not paying anything for to get this treatment or to get this session or anything. So that's pretty much really good about this program. And you get like 2 hour session weekly and by like train HRSA instructor for 16 weeks. So these topics have been searched on this website like sexual education for autonomy, sexual health education and behaviors, right decisions, gender and health topics, romantic relation and physician related concerns. I have also provided website link here. So if you wanna go there, book an appointment, and talk to any consultant, like you can do that. And I have also provided references in my last presentation. There are all the references for my part of the presentation, and yeah, that's pretty much about it for our presentation. We have tried our best, and I hope it's useful for people with disability and that provides enough knowledge for them to have like more sexual education. Thank you so much.